Hi, I'm Terri Bogue. I'm a clinical nurse specialist who specializes in infection prevention. We're going to talk about face masks and how they protect us and other people. Now, as we talk about face masks, it's important to understand how COVID-19 is spread. COVID-19 is spread through droplets that escape our mouth and nose when we sneeze, cough, sing, or even talk. Preventing these droplets and the viruses they transport from contact with our nose, mouth, and eyes is the key to preventing the spread of COVID-19. Wearing a face mask is important to stop the spread of COVID-19 because face masks limit the distance droplets can travel, minimizing exposure to those wearing masks and the people around them. Masks have different purposes depending on what they're made out of. A cloth mask provides what we call source control. That means it keeps people from spreading COVID to others. If everyone wore a cloth face mask, we would all be protected from COVID-19 exposure. And if we combined this with social distancing, we would greatly reduce the spread of COVID-19. Procedure face masks, like you might see in a doctor's office or a hospital, provide protection for the person wearing the mask, as well as providing source control to protect others. These masks protect the wearer from inhaling droplets in the air that may contain COVID-19. And many businesses are providing this type of mask to their employees to protect them and the people they encounter. Wearing a mask is really pretty easy. Being comfortable in a mask takes a bit more time and patience. Before we talk about how we put on and take off our mask, we need to talk about contamination. Okay? The inside of your mask, or the part next to your face, needs to be kept clean to protect you. The outside of your mask will always be dirty. All the pathogens that are in the air are trapped on the outside of the mask when you inhale. This is important to remember anytime you touch your mask. The outside is covered with pathogens. Don't touch your face or anything else after you touch the outside of your mask until you've cleaned your hands. It's sometimes hard to keep from touching your mask. You might want to reposition it or just feels funny, and that's okay. It's okay to touch your mask. Just be sure you clean your hands afterwards. When you're putting on your mask, the first thing you want to do is clean your hands. We want to make sure we're doing that appropriately. So we clean our hands to keep from getting anything contaminated on our mask. We want to make sure that we don't contaminate the mask as we put it on our face. Now, the first thing we're going to do is talk about putting on a mask with ear loops. When we do that, we're going to grab the mask by the ear loops. It's always important that we don't handle our face mask by the portion that covers our face. So we pick it up by the ear loops, we put it over our face, and we put the loops behind our ears. Once it's comfortably behind our ears, fit that metal piece to your nose. You want it to seal to keep anything from dropping behind it, and pull it down under your chin so it completely encases your mouth and nose. Now, we've got our mask on. We're going to clean our hands again before we go out and do the things we need to do. Next, we're going to talk about putting on a face mask with ties. So again, we cleaned our hands appropriately. We pick up the face mask by the ties this time, and these masks look a little different. They're not going to have the metal lining usually, but we use the ties to fit them over our face. We tie the first tie at the top up towards the top of your head so that it fits securely. And then you tie the bottom tie behind your neck so that it pulls the chin piece in against your neck to prevent anything from coming in. All right? Now, just like the ear loop mask, we want to make sure that it fits snugly against our nose and it's down under our chin. And we have our face mask on and we wash our hands again because we touched it, right? We sealed the nose and we made sure it was under our chin, so we want to wash our hands again. Now, we're going to take this off and we're going to talk about a few mask failures. A mask is only effective if you wear it to cover your mouth and nose. We've all seen people wear their mask under their nose. Have you seen this look? It's interesting, isn't it? Or they might wear it around their neck because our neck protects us a lot. But when we do that, we've run this part of the mask across the top, across our face, and contaminated ourselves. How many of you have seen this very popular and stylish ear hanging technique? This doesn't protect us at all. What we do know is when you're wearing your mask and it's not covering your nose and mouth, the contaminated surfaces can come in contact with your nose and mouth and allow the pathogens direct access to your body. When you take off your mask, be sure to remove using elastic bands or the ties. Don't touch the front of your mask. Remove your face mask and dispose of it in the trash, or if you're going to reuse it, store it in a safe place. Make sure not to touch the inside of the mask to any surfaces if you're going to reuse it. You also need to be aware of where you set your mask. The outside of your mask is contaminated. And when we set it down, we want to set it down dirty side down so that our face part isn't touching anything. So set it on a napkin or a paper plate or put it in a new brown paper bag. So remember, the outside of our mask is contaminated and it can spread pathogens to the surfaces where it's placed. Face masks, when worn over your nose and mouth, are an essential tool in preventing the spread of COVID-19. But when they're used inappropriately, they can be a weapon that spreads COVID-19 to the wearer. The choice is yours. Wear your mask well and protect yourself and others from COVID-19.